You're watching W33BY, Detroit, Highland Park, Michigan. The views and opinions expressed on the following show are not necessarily the views and opinions of W33BY, its affiliates, management, or sponsors.
Trying to live like, there's no consequences. They tell us how to live right. We get all defensive. That's not the way that life works. Sorry to bust your bubble.
Good afternoon and welcome to the Wellness Report with Helen. I'm your host, Helen Pendleton, and I am so happy today. We have a wonderful show planned out for you guys today, and I have a wonderful, beautiful guest who is my own personal dentist, and I'm so glad to have her on. Dr. Cara Evans, and she is here today, and we have a whole bunch of questions for her. Welcome, Dr. Evans.
Thank you, Helen. How are you doing?
I'm doing well.
Good.
Dr. Evans has, in her short life, she has accomplished a lot. She's a native of Virginia, and at a very young age, age of 10, which interested me because my son is 10 now, so I know that you can listen to your kids when they tell you what they want to be at age 10, right? And she knew that she visited to the orthodontist, and she wanted to be a dentist. So she went to school for biology and chemistry, correct?
Right.
And Virginia Commonwealth University. And she has so many accolades, and she graduated from U of M. So all of you U of M rooters that's rooting for the basketball team out there, that's her alma mater. So she's a proud participant of that university. So we're glad to have her on the show. She's currently practicing general dentistry in Detroit at the Wellness Plan in Detroit, and I stumbled across her. My normal dentist was not there, and they said, would you let her work on it? She was just so young and cute. I couldn't believe that she was a doctor. And I said, sure. So that shows you got to take a chance sometimes with someone. And she's done wonderful work on my teeth, and I'm probably obsessed with my teeth, and I make sure that I practice everything she tells me to do. So, and then you'll know what that is too, because I know some people don't know dental hygiene. They think they do. So I'm so excited to have her on the show today, and I'm going to use her as a vessel for women that want to do it and they just don't want to dream it. So I'm going to use you today, Dr. Evans.
That's all right.
Okay, so tell us what was going on in your mind at age 10 that you wanted to be a dentist?
Well, when I was younger, I was obsessed with my smile as well.
Right.
So I needed braces.
Uh-huh.
And we knew, like when I was about 7 or 8, that I needed braces. So
Right.
I started doing my own research and asking my dentist questions about like how long I had to wait till I could get braces and like all these different questions. And then when I finally met my orthodontist, he had like all the answers.
Really?
And I just thought it was so cool. He told me how long it was going to take for me to have the braces, and we had a idea of what I would be looking like. I was just so excited about having braces.
Did you have the rubber bands and
I
stuff?
did.
Oh, that's so
the
cool.
Old school. And so at that time, year 10, everybody had braces, so it was really cool. But I wanted braces for so long, and I finally got them when I was 10, and I just fell in love with my orthodontist.
Really?
I thought he had all the answers, and it was just so cool. And then when I was 13, I finally got the braces off, and I knew that that's what I wanted to do. And I wanted to make other people feel the way my orthodontist made me feel. So,
yes.
To feel positive about my smile.
Yes,
and
yes.
to feel good about myself. That's kind of what I wanted to help other people do. The goals have kind of changed as I've gotten older.
Right.
And as I've progressed in dentistry. But initially, one of the main reasons I got involved in dentistry is because I wanted to help other people feel good about themselves the way my dentist made me feel.
Yes. Okay, now this is a trick question.
Okay.
But when you look into a patient's mouth, can you tell if they've had braces just by looking at it?
So there are sometimes you can. So one of the things that you look at, a lot of times before patients have orthodontic procedures, they end up having to have premolars taken out. So if I look in a patient's mouth and they have 4 premolars missing, 2 from the top and 2 from the bottom, I pretty much assume that they had braces.
Oh, okay.
So that's one way. And then sometimes they'll have permanent retainers that are
Okay.
placed on their teeth. I have one behind my 2 front teeth to hold those spaces together because your teeth are constantly moving.
Right.
And even after the braces, they can go back.
Yeah, I
and
heard that.
shift.
Yeah.
So sometimes you'll see patients with the permanent retainers, and
Right.
you'll know, you can assume that they had braces in the past. So those are 2 indicators.
Right.
Sometimes, I mean, patients will tell you. But,
Right. So you know I don't have them. I never had them since you seen all in my mouth. So. Yes. Okay. So I know in the medical field it's very challenging and demanding. How do you plan and practice time management? Because I know I work with doctors, as you know, and it's challenging to have a personal life, and just how do you balance that? And you're still young, so
So right now it's kind of much easier than it was in the past. While in dental school and doing my residency, it was really stressful to carve out time for myself,
Right.
And just to kind of remember who I was. For me, I grew up in a religious household, and faith was always important.
Yes, it
and
is.
So one of the things, my outlet when I was in dental school was going to church and being involved in church and singing and doing things like that, and that was my outlet.
Okay.
And so it's very important when you get involved in medical school or dental school or whatever you're doing that you don't lose those things, that are important.
Right.
Now, as far as the time management piece, I'm still working on that. So maybe, we can talk about that later.
Right.
But I think that I do a really good time of very good job of trying to make sure I make time for my friends and family. They might disagree, but I think I do.
You
a
try
good
to
time.
juggle it. Yeah, I know it's difficult, but we'll talk about that. That's what I do. Okay, now what do you recommend for children? Because I told you about my niece, and hi Dominique, she's going to school for anesthesiology, and she's got her mind made up of what she wants to do. So I'm trying to give her some tips here too, along with a lot of viewing audience. So what do you recommend for children that know that they want a dream, they have a dream to be a doctor? Do you recommend that they implement that early in life, like you did, or?
I mean, not everybody knows exactly what they want to do. I think I was very fortunate to figure that out and then decide
and plan
for that. But I think that students that are interested in medical school or dentistry, do well and focus while you're in school. That's really, important, making sure you have good grades. And then also being able to find someone who's interested in the path that you're interested in to kind of help you navigate that. For me, I was very blessed. My cousin's a dentist. So when I was in high school, I was shadowing at the dentist's office. So, and I thought he was a pediatric dentist, so I thought I wanted to do pediatric dentistry.
That's another animal, huh?
Yeah. So it's nice to be able to find people in your community that are doing. And what's interesting is a lot of people, I don't know anybody. But anybody that you ask who has gone through it is more than likely willing to help you along the way. Also, we're blessed in the state of Michigan to have 2 dental schools in the state of Michigan. So you have the University of Michigan and you have Detroit Mercy. And if you go to the dental school, sometimes you'll be able to connect with people who are recruiters, or they have information about summer programs for high schoolers or college students. So if that's something you're interested in, there are programs that kind of get you that early exposure into the field beforehand. And I think that's what's most important, is making sure you get that exposure early on, because there are a lot of people who think they want to be a doctor and then they go and they're
like, I'm grossed out. I can't even watch blood. Right.
So it's really important to get that exposure. The earlier, the better.
Right. Okay. That's good to know. So I know dental hygiene is important. I know it's probably important to me. I told you about a personal situation with my god brother who passed away from a lack of dental care, and he had a infection that messed up his heart valve, and he went into cardiac arrest, and he passed away. So it's important to me, and people don't realize how important dental hygiene is and how it's related to health. And I know I take it seriously, but tell the audience what proper dental hygiene is in case they don't know, because everybody else, they think you just got to brush your teeth and you floss, and as we've discussed, sometimes it's people that don't know,
Right.
and you can't assume everyone knows. So
Right. So, well, the basic oral hygiene is you want to make sure that you're brushing twice a day.
okay,
For 2 minutes, twice a day. So,
okay,
and you want to make sure that you're flossing at least once a day.
okay,
So for children, you want to start brushing their teeth as soon as they come in. You want to use a pea-sized amount of toothpaste, nothing, not too much. I mean, when to brush their teeth, and until they're about 6, they're not really able to brush their own teeth.
right.
They
I was
don't
going to
have
ask that because
dexterity.
some people just
Yeah.
assume that they can.
Right.
Okay.
And so it's okay to foster that independence. So you might want to let them brush first
And supervise
then,
them.
right, and
Yeah.
then you can go back behind and say,
Right.
oh, let me check and make sure they're all clean,
Yeah.
and go back behind to do the brush afterwards. Also for adults, you want to make sure, and kids actually, you want to make sure that you keep that 6-month checkups
Yes.
and cleanings.
Yes.
That's very important.
Very, very important. I know
Things
about
change,
that.
Things change in 6 months.
Yes, yes.
Things can change. And then you also, as far as another thing that people don't think about is changing your toothbrush. So you want to make
Yes.
sure you change your toothbrush every 3 months, and also
Mm-hmm.
whenever you get sick. So if you're sick, you have a virus or something like that, constantly exposing your mouth to those bacteria kind of makes it difficult to heal.
Right.
So you're kind of reinfecting yourself. So
Right.
whenever you get sick, change your toothbrush.
Change it too. So all these people that got these fancy $400 toothbrushes, make sure you buy the attachments and change them.
Right,
You know,
get the
because you get
replacement
caught
head.
up. Yeah, because people get those toothbrushes and then they don't keep up with the attachments.
Right.
They, you gotta. That's part of your dental hygiene. So me, I just get the extra soft Oral B.
Right.
I stop all that spending all that money
Right.
on those fancy. I like to use so I can get down in there and get the back,
Right.
So it depends on you, but I just prefer to
And
toss
soft
away.
soft bristle is better too. As
Yes.
Well. It's less abrasive on your teeth and your gums.
Yes.
So medium to soft is what you typically want to use.
Right.
As
Okay.
far as
What about for people that have dentures? Do they have to do dental care too, even though like they might not have teeth or
Yes,
there's
so
certain
even with dentures, there's certain things as far as hygiene that you want
Mm-hmm.
to be mindful of. So dentures are to be taken out at night. So a lot of people
Keep
you meet
'em
some
in.
patients that keep them in. That's not okay.
Yeah.
So your tissues need a chance to heal.
Mm-hmm.
So it's just like having your shoes on. And one of the ways I talk
Wow.
about patients is you don't go to sleep with your shoes on because your feet.
I
need to
hope not.
breathe. I hope you don't. Yeah.
Right.
Some people might. I don't know. But you want your feet need to breathe at night.
Right.
So your gums are the same way. They need to breathe.
They need to
and
breathe.
So that tissue needs a chance to reset and relax. And when you have that constant pressure, it's very difficult to do.
Mm.
So what we'll see with patients who do not remove their dentures, you'll see sores.
Like canker sores
in
and
their,
stuff
yeah,
like-
and
yeah.
they'll be in their gums, and the dentures will be painful. You'll see you'll see tartar build up
Mm-hmm.
on the dentures. So on the partials, which in turn is not good for the longevity of the denture.
Mm-hmm.
So you want to make sure that you're keeping your denture clean, you're brushing it,
Mm-hmm.
or just using soap and water, or you can brush it with toothpaste. Just make sure it's non-abrasive, and keeping that clean, and
Right.
then soaking it at night. And the main thing is just making sure you take it out at night.
Yeah, because I tell people all the time, I say, two important things is where you sleep and you eat with your teeth. You do everything with your mouth. And so it's important. That's probably one of the most germiest parts of our body, I hear, our mouth. So it's important that you keep it clean. And I know that sleep is important. So I say invest in your sleep because you sleep 1/3 of
Right.
your life. So, if people want to buy like a cheap bed, but then they got like the biggest TV you can
Right,
see.
right.
So, I try to, tell people that it's important that you have a good mattress and that you take care of your teeth. So that is important. But for those people that don't think dental hygiene is that important and they got poor dental hygiene, give us some examples of problems that can occur for poor hygiene.
So from an oral standpoint, when we think about hygiene, we typically a lot of people think about cavities. So cavities are important as far as infection. They are a source of infection, decay.
My son thinks they're sugar bugs.
Well, that's what we tell the kids.
I said,
the
this is a
sugar
new
bugs.
name. They didn't
Right.
have that when I was out,
Yeah,
when I
that's
was
what
going.
that's what we call it
Right.
for the kids. But so that's one area that we think about as far as making sure you you don't want to let the cavities sit and not be treated, because
Right.
when they don't treat themselves, they don't get better.
Right.
If you have a frank cavity, a hole in your tooth, that at that point it will not restore itself.
What is it called again?
A frank cavity. So a
Oh,
frank
okay.
cavity is something that you can stick the
Wow.
dental probe into. So that would mean it's frank cavitation. So there's definitely a hole. There are some cavities that they're into the enamel, but they're not so far gone that maybe you
nerve
can
damage or
you
something,
can
right.
you can recover. If you do some fluoride treatment, you can recover. But when at the point where you can stick something in it, it's
So that
pretty much
means
time to
that
fix.
you're not doing proper dental hygiene
Well,
then,
you might
right?
have the dental hygiene, but you have to also think about your diet. So,
Oh.
if you're eating a lot of carbohydrates, eating a lot of sugar, drinking a lot of pop, drinking a lot of
That's why I'm on a low
Powerade,
sugar detox.
right?
24 pounds, you guys, so far from low sugar. So
Yeah.
yeah.
So if you're eating those things and you're doing those things, and then on top of that, like you don't brush after,
Right.
or you have a cup of coffee for students, like college students will stay up all night drinking coffee with sugar
Mm-hmm.
or caffeinated drinks with sugar, and then you're tired, you're not brushing your teeth before you go
Right.
to bed. So
Exactly.
those kind of things will add to the increase of developing a risk of developing a cavity.
Right.
So at that point, that's when you need to get it fixed. Now, if they are prolonged, then you get, the decay gets worse, and then you either
Right.
need a root canal or you end up needing extraction. So that's one thing we think about. But the other thing we think about
Mm-hmm.
is gum disease. So
Wow.
there's two levels that we think about with gum disease, and one of them is gingivitis, where your gums are just being affected. So your gums are inflamed around the tooth, and that's one thing. And then once gingivitis progresses, if that's not treated, you don't get the cleaning, you're not practicing proper home care with your brushing and flossing, you're not doing your 6-month checkups like we talked about earlier. That'll progress, and then the gingivitis will become periodontitis. And periodontitis is the second level, where you start to lose bone around the teeth.
Wow.
So as you lose the bone around the teeth, of course, you can potentially lose the teeth because you're losing that support. And once you've lost the bone, it never comes back.
Right.
We can help you stabilize it, but once the bone is lost, it doesn't come back. So you end up having to have some type of treatment where you have you can have grafting done to add bone back,
Right.
or
That can be costly,
and that is
and
expensive,
you could
yes.
just take 2 minutes twice a day and
Right,
brush your
and prevent
teeth
that.
and prevent that, and go to your dentist every 6 months, and
Right.
and I try to, like you were saying about time management, those things are important to make sure that you
Yes.
check on your health, and if there's anything, because prevention is
Right.
better than
And
cure.
the thing
So
about it is, the reason that you want to prevent it is more than just for keeping your teeth. Yes, periodontal disease, you're at risk for losing your teeth and the bone around your teeth. But the other thing you want to think about is the effects that those have on your health. So we were talking about
right,
it earlier.
exactly.
A lot of people don't know that patients who have periodontal disease are 2 times more likely to have heart disease. We also see a correlation between diabetics and periodontal disease.
Right.
So with diabetics, it's very difficult for them to heal. In general, there's a difficulty in healing.
Yeah.
But once you have periodontal disease, the increase of the bacteria that's going on in that interaction with that bacteria, that increases it decreases the body's ability to deal with the insulin levels and the sugar as well.
Wow.
So
Okay.
they play a role back and forth.
Right.
It's a role that they
Exactly.
play. And then there's also studies that show links between premature birth in women, in
Wow.
pregnant women who in patients who have periodontal disease. So there are studies that show that women who are using antimicrobial mouthwashes and brushing their teeth are less likely
What is
to have
that?
premature.
Make sure I'm not using that. What kind of mouthwash?
So chlorhexidine is one of the mouthwashes that we use as a antimicrobial, antibacterial mouthwash. So that's in certain cases. So that would be like a prescription mouthwash.
Oh,
So that's
okay.
not like the general mouthwash.
Okay.
But that if they're using that will decrease their likelihood of having a premature
Right.
birth.
Okay.
And then I found another one that's interesting as well. I was telling you about this one,
Mm-hmm.
that men who have periodontal disease are 7 times more likely to suffer from erectile dysfunction. So and that's because of the increase of bacteria that's in your mouth, and it goes through your bloodstream, it travels through your body, and it can affect your blood vessels.
So if they have that, you can rule out by going to your dentist. If you make sure you can eliminate that by going to your dentist to check and make sure before you go to get Viagra or Cialis or whatever. You might want to check with your dentist because 7 times, that's pretty substantial.
It puts you at that risk.
Right.
So you want to make sure that you are taking care of your oral health, especially when it comes, if you're a diabetic, or if you have heart disease,
right,
or you have another immunosuppressive disease. It's very important to keep up with that, because that bacteria in your mouth goes through your whole body. So your mouth is the portal to your body. So you think about the things that you're putting in your body, and think about how you're taking care of your oral health is one of those really important.
And so it's not just what you eat. I know here on the Wellness Report with Helen, we talk about what we eat, we talk about other things we consume, but you don't think about like toothpaste, and I struggle with that, like what type of mouthwash. I've changed mouthwashes so much. I got from the most expensive to the cheapest. So I really don't know. I just figure, if I'm going to the dentist like I should and I'm doing everything right, I'm okay.
So a lot of people are there's a lot of fluoride scares going. People are afraid to use fluoride.
We used to have fluoride in the water.
Right.
Now, bottled water does not have fluoride unless it specifies it. So.
But I will say that fluoride in correct doses is good for us. And we want to make sure that your toothpaste has fluoride in it. I also recommend for some of my patients who have a lot of decay is to use mouthwashes that also have fluoride in it. So you can get like Listerine, that's good for your gums, but it's also good for your preventing cavities because it has that fluoride in it. So you can use that as well. That's something that I recommend, the purple Listerine. So if you see the purple Listerine,
that's what I have
that's
too.
That's what I use.
That's what I have too, and it was on sale, $6. It was a huge bottle, so it lasts for a long time. So but that's stuff like that is so important. And here we try to help the community and give resources to people that might not be able to get it on their own. So for low income people that don't have dental insurance, what options do they have for dental care? I know you said the universities sometimes have student dental schools and things where they can go. What about that?
So that's one avenue is dental schools. We're fortunate in Michigan to have 2. And so you have Detroit Mercy, you have the University of Michigan in Ann Arbor. And so those are 2 avenues. But also in the city of Detroit, we have a lot of FQHCs, which are community dental clinics all throughout the city of Detroit. And the one that I work at, the Wellness Plan, is one such organization.
Yes.
So the Wellness Plan has been in operation for several years.
And you see the apple?
Yeah.
That's how you know.
For about 35 years. The dental has been in operation, I think, going on 5 years in October. So, and we have 3 medical centers in the state of Michigan. So the one that you go to on
the Boulevard,
the gateway on West Grand Boulevard, and then we have one in the East Clinic that's out
I think it's on Outer Drive.
Yeah, Outer
and
Drive.
Then there's the one in Oak Park. Yeah.
And the one in Oak Park doesn't have dental, so but the other 2 do.
Yeah.
And so that's one thing, and we are very good about trying to make sure that we help underinsured patients. We accept Medicaid dental plans, the state dental plans, and health plans as well. But there are other, we're just one of many FQHCs in the area that do that. But we are very committed and dedicated to helping patients with their health care, making sure, if navigating the insurance, as well as kind of helping them figure out, what comes next.
Right.
And so we have medical, pharmacy, and dental at the 2 locations I mentioned, and then at the Oak Park, they just have the medical and pharmacy.
Right. Yeah.
So,
okay.
But there are other FQHCs in the city of Detroit. You just have to look them up. But community health clinics are like for patients who are trying to get into the healthcare system but aren't really sure, have a lot of questions. Those are the places that you want to go.
And you can always contact me, through email. You guys are really good about sending me emails or calling me if you have questions, and I can direct you to how to get in touch with the Wellness Plan if you need additional information. Now, Dr. Evans, if a young person asked you, they said, I want to be a dentist or I want to be a medical doctor, what advice would you give them? And like if they want, say they're 10, like you were when you figured out.
Well, You can definitely do it. So I did it. And so if I can do it, anybody can do it. And just, stay focused. Don't
Yes.
ever let anybody tell you that, you can't do it.
Yeah, that's true.
When I was a kid, my parents made sure that we had African American female doctors. So my pediatrician was an African American female. My dentist, growing up, that's who we saw.
Yeah.
So I always knew that black women could be dentists, or
Right.
So it was never an issue for me. But I think that it's very important to never let anybody tell you that that's something that you can't do.
That's true.
If you have a dream and that's what you want to do, follow it, stay committed, and find out as much as you can about whatever it is that you want to do.
Yes.
And find out, like, don't just depend on one source. Make sure you have many sources on what you want to do, and following somebody who's done it is
Yes.
one of the best things you can do. Somebody who has a similar background as you, or maybe it's from the same neighborhood as you.
That's true. Okay.
That can kind of tell you how they did it, and listening to their stories. And then also know that everybody's journey is different.
Yes.
So, the way I did it might not be the way that you do it,
Yes.
or the way he does it or she does it. So you just have to be open to letting things happen the way they happen, and things happen organically, and just be open to learning and to discovering, and just don't let anybody ever tell you that you can't do something.
Right.
Because you can.
Okay, so we're going to fast forward like 15 years from now to the more mature Dr. Evans, okay, that you haven't met yet. But you will see her 15 years from now. I know that you have a passion for teaching. What would Dr. Evans look like 15 years from now? Or what would your vision be for her?
I think I probably would be working at a dental school somewhere, at least part-time. I probably would be married with 2 kids. We talked about that.
Yes.
We talked about that. And just trying to encourage students to get involved in dentistry. So right now we have for minority students, there are not that many minority students interested in dentistry. There are a lot of maybe interested in medicine, but not as many interested in dentistry. So trying to reach out and making sure that we have the support in those communities to pull those students in, that probably would be my focus. And to get making sure that we keep that diversity going
Yes.
in the workforce, in the dental workforce. So that's probably what I'll be dedicated to doing.
Yes. Well, we are really honored to have Dr. Evans with us today. And I would like to thank Sean Watkins, my producer, and I'd like to thank ARC Laboratories as a sponsor for the show. And I appreciate you, as always, for watching the Wellness Report with Helen, and we will see you next week. Have a blessed day.
We trying to live like, there's no consequences.